Does anyone think that Canadian drug policy is working? I don't. We create compassionate policies and consider ourselves one of the most progressive countries in the world, and we probably are. The problem is that our progressive approach is actually costing us lives, Canadian lives that could be saved. It's time to reimagine how we do addiction treatment in Canada, because there is a better way forward. Since 2016, we've lost over 12,000 Canadians to addiction and overdose. In BC, you're 17 times more likely to die of an overdose than by a homicide. In the past 4 years, we've been losing over 4 people a day in this province. And I don't think that's good enough. Somewhere along the line, we just started accepting that when people are down, they're not going to get back up. You see, in BC, 90% of all funding goes towards harm reduction. Things like substitute medications, clean needles, safe injection sites, and other policy prescriptions that are designed to keep people alive. And they have merit. They're good. They do work. My problem's with the funding discrepancy. See, only 10% of all funds go towards actual rehabilitation. The one thing that can get people to living their best lives once again. In Canada, we have socialized medicine. I like it. Most people like it. But somehow addiction is the only fatal disease whereby treatment isn't guaranteed. If you're extremely poor, you can get put on a wait list for a government-funded bed, a wait list that might last you multiple months long and never guarantee you a place in the center. If you have money or your family's wealthy, they can send you to a private treatment center, a private rehab, one of the many that dotted across our country. And I'm fine with that. If you can pay your freight, we should accept people paying their freight. The problem is that the majority of Canadians end up somewhere in the middle. Families who have paid taxes their entire lives are put into a difficult position. They need to help their family member, but they can't really afford it. They're asked to cash in their RSPs, take out a second mortgage on their house, if they own a house, or take on high-interest loans. All they want to do is save their loved one, and they often end up mortgaging their future. Clearly a healthcare matter, the addiction file has been steadily removed from the Ministry of Health. New ministries of mental health and addiction have been popping up in all the provinces. Sounds good, doesn't it? Here's the problem. The Ministry of Health in BC is funded to the tune of $20 billion a year. 20 billion, as in $20,000 million a year. What about the Ministry of Mental Health and Addiction? $70 million a year. Addiction is drastically underfunded. But here's the thing. It's not actually cheaper funding harm reduction than it is funding treatment. And I have a dirty little secret for you. Treatment can actually pay for itself when it's prioritized. Money is too often the decider about whether people get help or not. Money is too often the decider about whether people get better. Addiction costs a lot of money, okay? In Canada, addiction costs us about $40 billion a year. $15 billion to lost productivity alone. Another $11 billion, healthcare costs. Tack on another 9 for criminal justice. No matter how you look at it, this is an expensive problem, okay? Each addict costs Canada about $40,000 a year. Yet you can pay to send someone to treatment for a few months for as little as $6,000 to $10,000. The problem? The government is only willing to pay for people if they qualify for social assistance. You have to be extremely poor. And for people they're willing to pay for, they only pay $40 a day. Now, since I have you hostage here, I want to ask the audience a question. How much does your life cost you a day? Me too. $40 a day doesn't get us very far. The reality is that the level of care that places are able to provide for the rate that the government is willing to pay adds up to only board and housing getting paid. You can cover food, but you can't cover any real programming, and that's the problem. In Canada, the mean income is about $50,000 a year. Your average worker will end up paying about $10,000 in taxes on that. So for every person we can put through treatment and return to productivity, they will be putting $10,000 a year into government coffers. But then you add in the fact that they no longer cost the government $40,000. At the snap of a finger, you have a $50,000 swing in the right direction. For every one person we can put through treatment and get them to stay sober and working for 20 years, you have $1 million swing in the right direction. So here's the reality. If we can have 1 out of 100 people who we put through treatment stay sober for 20 years, treatment pays for itself. Right now, the system we're running does not work. We are hemorrhaging money, families are hurting, death is all too common, and addicts are staying addicted. Access to treatment needs to be guaranteed for everyone, and that's the compassionate approach. All of us know about the downtown Eastside in Vancouver. It's horrible. There are people living in abject squalor down there. It's completely horrific. The reality is, using harm reduction exclusively is not working. We know that. We see that. There's human suffering on a grand scale happening. Our addiction system is at a breaking point. Everyone knows it, but no one wants to talk about it. Now I want to take you across the Atlantic. Let's look at Switzerland. They had the same addiction policies as all the other Western countries for a long time. Zero tolerance drug laws, minimal access to treatment. But by the 70s and 80s, they had some of the worst addiction rates in the world. Disease was through the roof. Does it sound familiar? Open air drug use was happening everywhere. In the 80s, they got fed up with it. They introduced a new policy prescription called the 3-pillar approach. Number 1, they went with prevention. All of us recognize that the best way to deal with the long-term implications of addiction is to actually prevent addiction from happening in the first place. Logical stuff, of course. Number 2, therapy. They decided then and there that access to treatment would be available for everyone who needed it, free of charge, covered by the state. Logical. And number 3, enforcement. Utilized in a non-punitive fashion, it was the mechanism to get people back to pillar number 2, therapy. It was a cycle. Now in the 90s, they introduced a new pillar, risk reduction, what we call harm reduction. Any rational person would recognize that we're not just going to magically make everyone who does drugs stop. Not everyone who does drugs is going to magically get better. We need to recognize that. Now, for people who can't or won't stop, restoration of dignity needs to be the priority. We want to allow them to avoid living a life of crime. We want them to get back on their feet. Now, obviously, harm reduction is a last resort. It's not ideal. We all know that. But it's necessary in some cases. Now, for them, instead of just producing and providing substitute drugs, they recognized that there were other needs. There was a need for housing. They hooked people up with employers so people could get jobs again. As I said, dignity became the key. Now, they came to an amazing realization, okay? Lost productivity was not due to drug use alone. It had just as much to do with the amount of effort and hustle people had to do to get the drugs to fuel their addiction in the first place. When you remove that, amazing things happen. Now, this policy was only rolled out in certain towns and cantons in Switzerland initially. In 2008, they had a referendum. The referendum was about rolling this around countrywide. It passed with 68% support. Has anything in Canada ever passed with 68% support? It's an overwhelming mandate. Now, of course, there will always be opposition to change. That's just a reality. But in the end, good policy prescriptions will win the day. Now, in Canada, I think it's time for us to recognize that our one-size-fits-all policy is not working. Our overuse of harm reduction is actually robbing people of the chance to get the treatment they need. It's also diluting the resources available to the people who actually need harm reduction in the first place. We need to be able to put more money into the housing and allow them to get jobs, whatever they can do. If it's prioritized, treatment can pay for itself, but we really need to reimagine how we're doing it. We need to stop turning a blind eye to the suffering that's happening around us. Productivity and a restoration of productivity needs to be made a key factor. We need to be willing to leverage the criminal justice system to get people the help they need. And the help they need is treatment in a lot of cases. We're finally starting to recognize that addiction is a disease. Addiction is not a moral failing. And I think it's time for the Ministry of Health to start treating addiction as it does any other healthcare issue. It's a healthcare crisis. We need a compassionate approach, not just because of the death and suffering, but because economically it makes sense. Maybe it's time for a Swiss model in Canada. Thank you.